Part 5. Getting questions wrong is okay. I know, no one ever told me that either. Let's figure out the importance of how to learn from being wrong. So as usual, we'll start out with a question. I'll give you a moment to kind of go over this on your own, figure out what's important, what do you think the answer is, and then we'll talk about it. So pause the video now and do that. Awesome. So when I went through this question, here are the things that I highlighted. First and foremost, the question, this patient is at greatest risk for developing malignancy of which of the following? Okay, so this is a risk question. I've got a few different areas of the body, and this is regarding malignancy, so I want to know what kind of risk factors she has. I've got this 16-year-old girl. She's got acne. She's gained 19 pounds. She's never been sexually active. Menses are irregular. Her last one was 3 months ago. Terminal hairs on the upper lip. She's obese. For some reason, they're telling me that testosterone and DHEA levels are normal. I don't even know what that means. I don't know why she's got the hair. She's gained weight. I feel like maybe I don't know what she's got going on. Thyroid problems or something. Thyroid's an answer. Malignancy. Man, I don't know. So I'm thinking, well, she's 16, she's obese, maybe that's a risk factor for cervical cancer. Seems right to me, so that's my guess. But as it turns out, the answer is endometrium. So how do I figure out what I did wrong? What do I learn from this? And where do I go from here? So why did I get it wrong? There are two reasons. Either it's a test-taking issue, or it's a knowledge deficit. Most people think that the majority of their problems lie with knowledge deficits, and they add on resources, and they get resource heavy. When in fact, most of the students I tutor have a test-taking issue. There's something simple preventing them from getting the right answer. The simplest thing to ask yourself is, are you running out of time? If you're running out of time, you're not pacing yourself on a question. There's not a whole lot you can do about that. You've got to get to where you can do a question in 90 seconds. If you get to the end of the test and you have 10 seconds for a question, there's no way to effectively do that. Once time is not a factor, of course, I bring up the steps that we've talked about so many times before. Last but not least, the core ideas of each disease process that we've talked about a few times as well. Those being the etiology and etc. Those are the knowledge points of medicine. Those are the clinical things that you do need to know. And there is a lot of material there, but if you don't even get that far, you're not going to get the question right. Most people get questions wrong because of this portion where you're trying to answer these questions. So these are going to be statements or questions you might ask yourself or say to yourself if you are getting a question wrong because of this step in the process. So reading the final question, I didn't know what they were asking. For example, here, this patient is at greatest risk for developing malignancy for which of the following? She doesn't have a malignancy. What's she at risk for? So, I didn't realize what they were asking. Maybe you were just picking a diagnosis, or I thought she had a thyroid problem, so I picked thyroid. Classify the answer choices. I don't even know what these are. Maybe that's a little bit of knowledge deficit. Maybe it's a pathology deficit. Maybe you don't understand that the different pathologies listed are associated with very specific diseases, and it's kind of a hidden way to put a disease name. Imaging. Is this a normal x-ray? I don't know. I need to know what normal looks like. I need to know what abnormal looks like. I've never seen this rash. Maybe it's something new. Maybe it's something benign. Maybe it's something concerning. Either way, I need to know. Labs. Maybe you didn't look up the normals. I've told you to look up the normals. You should look up the normals. Don't get questions wrong because you don't look up the normals. Maybe there's a lab I simply didn't see, or maybe I didn't realize that a lab was pertinent in this question. The last couple lines, maybe they spoon-fed me some information. I totally missed it. Maybe I just need to pay more attention to that. In one of the previous videos, we had an example where they gave us a spike in the IgM. Okay, fine. Reading the prompt and highlighting. I didn't even see that word. I didn't even see that it said that. This is probably the most common thing. And even in answer choices, I didn't see that word. You have to make sure that you're combing through the words. Every word is important. Yes, every word is important. You have to decide whether it's pertinent or not. And ruling answer choices in or out. This typically is knowledge deficit. You've identified all the correct information that's important. You're just not able to figure out whether or not it includes or excludes an answer choice. But by far, the most common thing that I see is reading the prompt and highlighting and missing words. Most of these problems can be eliminated with practice. Most of these are purely test-taking issues, and if you're not highlighting appropriately, you can't get to first base. You've got to make sure that you're catching all of the information and deciding for yourself whether or not it's pertinent. So this brings us back to the core idea, and that is the clinical knowledge associated with disease processes. You absolutely need to know each of these things for every single disease process. If you don't know these things, you can't pick things apart. So, going back to the original question, I thought it was cervical, but turns out it was endometrial. I don't know what this girl has. I said maybe she's got some thyroid problems. I don't know what's going on here. The question explanation tells me that this girl has polycystic ovarian syndrome. Now it's making sense. I start to see how some of these signs and symptoms are lining up and how it shapes up to be polycystic ovarian syndrome. It makes sense. So this girl has polycystic ovarian syndrome, but why would she not be getting cervical cancer? Why is that ruled out? What I didn't notice was that she had completed the HPV series. I don't think I would have chosen cervical cancer had I completed the HPV series, but I didn't highlight it. I didn't see it. I don't know why. I didn't comb through the question slow enough. Aside from not being able to identify that this was not going to be cervical cancer, endometrial cancer was nowhere on my radar either, right? So polycystic ovarian syndrome leads to endometrial cancer. Who knew? Why, in this question, is it important that I know that she has polycystic ovarian syndrome? What if I just looked at these signs and symptoms and said, I'm feeling like she might get endometrial cancer? Yeah, that might get me the right answer, but maybe not on the next question. Without changing any of this information, look what we have here. It's the same stem, it's the same patient, it's the same issues. Which of the following is the most likely diagnosis? So here, instead of being asked about potential malignancies, all we have to do is get to polycystic ovarian syndrome. I know it's not hypothyroid. Waldenstrom, we've seen that. I don't think it's that. And there's our PCOS. So what we did was we used the core idea. We took these signs and symptoms and developed a diagnosis of polycystic ovarian syndrome. That was step number 1. Second was an isolated question of what's the pathology and what are the complications of polycystic ovarian syndrome. That was the second step to this question, right? What I needed to understand about polycystic ovarian syndrome here was that the excess adipose converted the excess androgens into estrogen, so now this girl has increased levels of estrogen. Increased levels of estrogen can manifest as endometrial cancer later in life, so that's her risk here. So it was important that I could deduce both the pathology and the complications. What if we were given this question? This patient is most likely to benefit from which of the following medications? Again, we still established from her that she has this diagnosis of PCOS. Now we're being asked not about pathology and complications, but instead about treatment. So we know that we would not necessarily treat her with vancomycin. That's not a good option. But instead, oral contraceptives are a good first step of managing polycystic ovarian syndrome. Going back to the question that I got wrong. How do I learn from this? What do I put in my notes? How long do I spend on this? So in my notes, I would review first the signs and symptoms of polycystic ovarian syndrome and make sure that I've got that down. Make sure that I know how to diagnose it. The second thing I would do is I would review the pathology and complications that manifest due to polycystic ovarian syndrome. Let's say I knew the manifestations and the complications, I didn't know how to diagnose it. I wouldn't spend any time looking at the pathology or the manifestations. I would simply look at how do I diagnose PCOS. And last but not least, from a test-taking standpoint, I totally missed that she had completed the HPV series. I didn't highlight it. I didn't see it. It tells me I need to slow down. I'm getting questions wrong because I'm not even seeing all the words. I might not have put endometrial, but I don't think I would have put cervical. I'm learning to hold myself more accountable by highlighting. Hopefully the steps of the process make sense. Now, I'm not condoning getting questions wrong, but I typically remember things a little bit better when I get them wrong. I'm probably annoyed with it, and it resonates a little better. Either way, now you have the skills to learn from it objectively in line with what we've already learned. Once you've separated this test-taking issue versus a knowledge deficit, you can isolate in on the individual steps of the process. Spend your time studying your weak points. Trust yourself on what you already know. In part 6, I'll answer some common questions that students have, I'll debunk some myths, and we'll wrap up this series.